Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging. We want to help you be more successful. And our guest today is Bradd Busick. He's SVP, Chief Information Officer at MultiCare Health System. Welcome, Bradd.
Hey, John, thanks for having me. Good to be here.
Yeah, excited to have you on and hear about your experience and you're doing a lot of interesting things. So, but before we dive into some of those, tell us a little bit about yourself and MultiCare Health System.
You bet. MultiCare is located up in the Pacific Northwest. We've got 14 hospitals and close to about 25,000 people. And like most other healthcare systems, are trying to navigate changing headwinds and do it with some elegance, and ideally do it with some automation and something that makes it easier for our patients to get the services that they need.
I think that's a good description of most CIOs' approach. It's like, how do we navigate all of this in a way that is great for our patients and great for our users? There's a lot going on, but talk to me about how are you thinking about and kind of approaching digital transformation as more than just this buzzword, like we need to transform. Like, how are you approaching it and thinking about it?
Yeah, I mean, transformation is one of those really interesting things it's kind of analogous to big data 10 years ago. No one even talks about it anymore. It's just something that we've done and that we do. And part of the interesting part for our own journey is every CIO that I know is starting out from a different spot, right? So 10 years ago, if you were in a spot of just wild deficit or technical debt, it's a really interesting place to jump from, particularly when you don't have anything to jump to. So if your technical debt is just overwhelming, you actually have to start there so that you can actually move towards a place of patient elegance. And that has certainly been our journey over the last, I'd say 5 years that I've been at MultiCare, as we've addressed a lot of technical debt and put in solutions that some are seen, right? Some of the things that our patients engage with, whether it's bots or an elegant access center, or robots in the hospitals. Others are not seen. Other the things that just allow connectivity and patients to get on our Wi-Fi when they need to, or get reminders for their appointments. I think the fallacy in digital transformation, John, is if it's not, measured, it's not managed. So how do you actually measure digital transformation? And I could digitally transform, and my costs could also go up to 20% of net revenue for the company. And so that doesn't land either. So you have to be thoughtful about how you do it.
Yeah, there's a balance there for sure, as far as not just spending more money, but actually creating impact. I think that's one piece. And yeah, I was trying to think, what is the digital equivalent of technical debt when it comes to AI? And my thought was it's probably the quality of the data,
Data.
right?
Yeah.
It's
Yeah,
the
it is that.
data debt almost, if
Yeah.
you will. That's interesting.
And that's what's really funny about, I mean, I think AI, but the truth is, I mean, we've seen this movie before, right? And we saw it with quote unquote, big data, which now has, nobody ever talks about it. And now it's actually just part of how we think about analytics. And um, if your data is bad, your dashboard's going to be worse, because all it's doing is holding the mirror back up to you to say, yeah, this is the actual quality of your data, which is not awesome. We're seeing the same thing now with AI, right? Like if you can't get to a definition on what length of stay is, it doesn't matter how many LLMs you have. It's not going to be adopted, and it's not going to be used because the consumers, or in this case, our own clinicians, won't be able to see themselves in it.
Well, and I think the difference too is that if you look at, hey, if a dashboard's wrong, then they just won't trust the dashboard and they won't look at it. Not a huge deal. It's unfortunate. But if the AI, if the data is wrong and the AI is wrong, now we're impacting something significant and they don't trust the AI. And if they don't trust the AI, then we have bigger problems. So I think
Agreed.
that's the challenge.
Yeah, agreed. And it does come back down to this kind of notion of change management and how you think about the willingness for people to trust you in that journey, but also know that in some cases it's going to be iterative, right?
Mhm.
And just because we have an EMR doesn't mean that all that data is right. And so being able to think about how to curate it, measure it, clean it, Doesn't happen overnight. And since we're 18 months into this kind of AI journey, I would predict that 2 years, 3 years from now, we won't even be talking about AI anymore. It's just going to be part of every single platform that we own, and the predictions and insights that come out are going to be table stakes to play.
Yeah. I mean, you mentioned change management. It's one of the hardest things. Nobody likes change. I think is the underlying core principle. But what are some keys to doing it successfully? What are some things you've done to approach change management to make it more successful?
Yeah, probably like every other leader, I think we've had hits and misses in this space. The hits that we have, particularly when we're introducing change to our clinical teams, is every change we roll out is actually operationally led.
Mm,
So when we rolled out autonomous robots, for example, in the hospitals, this isn't the CIO saying, "Hey, we need autonomous robots in the hospital." It was in partnership with our chief nurse executive, because initially that was the use case we were going after. How do we give time back to our incredible nursing staff at the bedside with our patients? And that's easier said than done. The upshot with technology is I can actually measure it now, right? Like I
mm,
I know these robots did 60,000 deliveries in 2024. Well, that's 60,000 less deliveries that a nurse had to go and do. And so what type of freedom did that provide back? And so we were able to create this continuous feedback loop to go back to the nurses and say, hey, this is how much time this saved. How did it work? What other things are you able to do that's higher value than walking across the hospital 20 minutes to the pharmacy and walking all the way back? And so I think there's a element, an art and a science of doing change correctly, particularly when it involves our clinicians.
interesting. I think there's this fascinating perspective that everyone wants innovation. We want the latest stuff, but we also don't want to change, right? As we kind of talked about, like those two are almost at odds because innovation almost implies change, in that thing. So how do you approach that to, make sure that you're doing innovative things and making them a reality, but not, obviously you talked about involving the clinical leaders. I think that makes sense. Anything else you'd add as far as making sure innovation happens despite people's desire not to change?
Yeah, I would say innovation is also another really interesting word. Like I think we think about innovation as a home run.
Mm,
Um, Sometimes I think innovations can just be base hits.
yeah.
They literally can just be singles. Eventually, those runs come in. But I think the organizations that I know that do this best actually do both. They stack the lineup with batters that can get singles, a couple that can get doubles, and then a couple of home run hitters. And if you zoom out over the course of the year on a portfolio, like what did you actually do in 2024? Not by way of being busy, but what net new capabilities or impacts did you provide? That actually becomes a really interesting lens to look at a show me, don't tell me format. Like, show me the value, John, that IT provided in 2024.
Mm,
And if you can't rattle that off, I actually think you're probably not the right CIO for that role. And there's too many passive CIOs that I work with that, one, don't tell the story, two, haven't earned the right to be heard, and three, don't have the relational capital to actually innovate. And so I'm thoughtful about innovation. I do think it's half change management. And in the world of technology, we've kind of almost entered this innovation fatigue, right? Where every new month we're rolling out a new bot or something that is supposedly makes their life easier. And the truth is, the devil's in the details on all of those. And so I love being able to come back and measure and then accelerating it if it works or ripping it out if it doesn't.
yeah. I mean, I remember reminded of an EHR user conference I went to where the EHR, and this was 3 years ago, announced that copy and paste was now available. And you're like, wait, well, there's
Yeah,
lots of reasons why they didn't implement it and they had it restricted for privacy and all this. But it was like amazing how impactful something like copy and paste could be for an organization,
totally,
right? Or,
totally.
the same thing, the right epic, tweak or form or
Bingo.
whatever could just be completely transformative for the right process.
Yeah,
So,
that's exactly right. And we're thoughtful about how we prioritize and stack rank those opportunities in partnership with our customers. It's not just Bradd Busick making a decision on what we go after. Last time I checked, I didn't go to medical school, and so being able to do that with our partners is honestly the secret sauce for us.
Yeah, makes sense. Talk to me, what kind of pressures is your organization feeling for more of a retail or consumer experience? We're seeing a lot of that in healthcare, a lot of discussion of that. And how is that impacting your organization?
From a retail lens, I'm also a consumer of my own healthcare systems services,
Sure.
and I want the experience that I have when I go to my urgent care to be as seamless and easy as it is when I call Alaska Airlines and make a change to the flight that I have this week. And I will tell you, we've made some really awesome strides in that space. From, again, these are singles, John. Like, I don't want you to have to wait in line for 30 minutes to talk to someone in our access center. We'll call you back. We'll send you a text message. Even better, you don't have to talk to somebody if you don't want to. Just text with us or use our bot to go schedule an appointment online. Um, Fast forward, what if I actually just said, you know what, this actually sounds like a better appointment for a video visit, John? Can I save you the hour of commute time? We can just do this on video. And let's do a pre-flight check to make sure that your phone's charged, that I can see you, hear you, and we can conduct that care over the phone and get you the prescription that you need. Um, the pressures that we're feeling is like every other healthcare system. It's financial. It's around 130 something executive orders that we don't know how they're going to impact our system. It's tariffs on hardware, and these are all things that patients engage with. They just don't know that they engage with them because it's the computer that their clinician is sitting at, or it's the access point that's providing Wi-Fi across the entire clinic. So anyway, there's a lot of opportunities for us to continue to grow here. I'm pretty optimistic about the trajectory we're on for a retail experience for our customers.
Yeah. I mean, there's so much opportunity. I described that a lot of healthcare took it for granted for a long time
Yeah,
because they had monopolies essentially, or at
yeah,
least dominant positions in different communities. And now it turns out the internet's flattened the world as it's done
yeah,
many times.
absolutely.
Technology has, and now there is more competitive pressure for that, more retail consumer like experience.
I love it.
Um, is there a project you're most excited about? And talk to me about it. Tell me what project are you're most excited about?
Yeah, this one has actually been a really interesting project for us to chew on. We actually started the work, John, before it was cool to even do something like this. In 2021, we started conversations about drone delivery in our geography for three use cases: prescription medication, lab specimens from one hospital to the lab, and then equipment delivery in support of hospital at home. And I had worked with this organization when I was at the Bill and Melinda Gates Foundation. I mean, at the time, the drone delivery capability was completely different because it was a fixed wing aircraft. It could have never flown here in the US. It was just too big. Well, as technology evolves, so does this capability. And so this year we'll launch the first drone delivery service here in the West Coast in
Wow.
partnership with Zipline. And
Okay.
back to the retail customer experience, we think that people don't want to wait in line at the Walgreens with a bunch of sick other people for their prescription. Deliver it to me at home or wherever I'm at the park with my kids. Just bring it to me. I'm happy to pay for that. And so we're going to learn this year about what that capability could be, and then partner with Zipline, our partner here, to give them that feedback as we become one of the sites here on the West Coast.
That's awesome. Yeah, I mean, we've seen what Zipline's done in Africa and
Yeah,
other countries, and the potential for what's possible. It's great to see that it's finally coming here.
finally.
With you, I don't know a single person who wants to go to a pharmacy.
Me too. Me too.
None of us.
Agreed.
Cool. Well, we like to wrap up these episodes with a little bit of career discussion, career advice. What would you say has been the best piece of advice you've gotten in your career?
Mm. You know, it wasn't so much advice, John, as it was maybe a mantra, and I'll tie it back
Okay.
to the Gates Foundation.
Uh-huh.
Um, if you headed down the hall towards Melinda's office, on the wall. She had the quote, if you want to go fast, go alone. If you want to go far, go together. And that's 100% true for my own journey. And I think it's 100% true for CIOs. Um, the most successful CIOs that I know, inside of healthcare and outside of healthcare, aren't the ones that take credit for the wins. They're the ones that are looking at their team saying thank you and extending gratitude for the outrageous work that's been happening over the last 5 years, specifically in healthcare with COVID, the financial pressures, and now just a ton of uncertainty, and frankly just threats to profitability. Right, like maintaining relevance in a market is really important. Um, the ones that aren't successful are the ones beating their chest saying, "Look what I did," and people don't want to follow those kind of leaders. And so this idea that everybody wants to be known, everybody wants to be appreciated is part of my, it's just part of my thesis. And that's how I lead, it's how I execute my team. And frankly, it's why MultiCare is where we are and why other systems aren't where they are.
Love that, Brad. I mean, that's a humble servant leader. I heard someone say it. I like the idea of a servant leader. I think that's a pretty apt description of kind of what you just described.
Oh,
So
agreed. Oh, thank you.
yeah, well, Brad, I appreciate you taking time to talk with us and share your insights and perspectives and the great work you're doing at MultiCare. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcast application. Thanks, Brad.
Thanks for having me.